All right, Lorna and CCM, we are ready to start in 5, 4, 3, 2, 1.
Hello, everybody. Good afternoon, and welcome to our weekly COVID-19 briefing with Montgomery County Executive Marc Elrich, Dr. Travis Gales, who is our health officer, as well as Dr. Earl Stoddard, who is the director of our Office of Emergency Management and Homeland Security. My name is Lorna Virgili. I am the Hispanic Public Information Officer for Montgomery County Government. I will be moderating. And for members of the media, this press briefing is for you. Remember to use the chat to ask for permission to record and also to request to ask questions during the Q&A portion of this presentation. And with that, we open the forum with our County Executive, Marc Elrich.
So this is a hard place to be in right now. I think everybody realizes that you never know quite where to start on this. So our case counts continue to increase, and much like the rest of the state and much like the rest of the country. And it's a significant increase in numbers that we're experiencing that makes this alarming. Today, our case count was 262. We had a positivity rate of 5.4. Our cases are 100,000 out of 100,000, 25 cases per 100,000. 2 weeks ago, we were at 13 cases per 100,000. And back in those heady days of July and early August, we were probably closer to 6 or 7 cases per 100,000. There were weeks when we had 45, we were looking at 45 cases a day, which would translate into less than 5 cases per 100,000. So this has clearly been spinning in the wrong direction. And each day we keep hearing reports about national records and the number of cases and the growing number of hospitalizations and deaths. There's no doubt that this virus is spreading very fast. And we are going to have to work even harder to win this battle. And this is a battle. And this is no surprise. This is everything people told us was going to happen. And folks completely ignored it. In the face of knowing this was coming, this whole country, there was a push to open more and more things, knowing that this was coming down the road. Or pretending maybe that you didn't know it was coming down the road. But whichever of those two scenarios people were in, we're now at the point where everything people said could happen is happening. It's happening at a large scale, and it's really challenging. Yesterday, the governor introduced additional restrictions. Personally, I don't think they went far enough. I think that, the stopping point between where we are today and where lockdown might look like would have been to try to maybe get this 25% occupancy and see if we significantly reduced occupancy of spaces and if we could get people to wear the masks all the time, maybe we could bend this curve downward. It's hard for Montgomery County to do it by itself. But I also want to say that I understand the governor's got really difficult decisions to make. I've said it about my situation, and my situation is certainly the same as the governor's situation. We're faced with basically two very difficult choices. You can either protect people and definitely cause harm to the economy, or you can open things up to try to protect the economy. And then the consequence of doing that is that we will increase the spread of COVID. I think what we're seeing right now indicates that it wasn't a tiny marginal spread of additional COVID. It is an avalanche of COVID that has resulted from these decisions. And everybody's in this environment where, and I can't think of how many weeks we went through this year, where people keep saying, your numbers are good, your numbers are going down, you should open up again. They went down and then they went back up. And like I said, we could all see this coming. Everybody's got difficult decisions to make, but I think the numbers are at the point, again, that we've got to err on the side of human health, and we're going to have to shut things down more eventually. I don't think that, that what he did is going to make a bend, is going to cause this thing to bend over the next 2 weeks. Last week I said, I hope he's right. I'm not confident that this is going to result in a downward trend. And in the end of the day, we really need the federal government to step in. And obviously it can't be this government with its make-believe doctor and the president who doesn't seem to take this very seriously. But we need a federal program that bails out businesses so that they can close without their employees or the owners fearing that closure means the end of their businesses and employees fearing that this means the end of their income. This is what's causing the stress, and this is what causes a lot of the resistance to closing, because you can't close based on you can't close comfortably based on the health information, because the consequences for individuals who own businesses and people who work in businesses are going to be so severe. This is where the federal government needs to step in, put programs in place that'll assure that businesses will be able to reopen, that they won't be hammered by the debt from having closed, and individuals know that if they don't have the money to pay rents or pay bills, that they're not going to be hammered by bill collectors and being evicted from their apartments or houses when this is over and when things go back to normal and all the bills are due. We need a federal program. We bailed out Europe once. We ought to be willing to bail ourselves out. So even though I differ with the governor, I do understand the pressure he's under. I wish he made another decision. I do hope we arrive in a different place. But all of us are dealing with a very difficult situation. We make tough decisions using data and science. And then the bottom line is the virus is not slowing down. And on the brighter side, after the virus hit us in the spring, we made decisions to strengthen Montgomery County. So we went out and stocked up on personal protective equipment. We needed it for our own employees. We needed it because we were providing support to adult centers. We were providing support sometimes to hospitals. We were providing support to small businesses. So today we have a supply of 13 million masks. We have 395 million pairs of gloves, 669,000 gowns and suits, and we have 218,000 units of sanitizer. So we are not in the situation where we were when the virus hit it the first time, of not being able to provide things that can make us safer. We just don't have a treatment and we don't have a vaccine. But we've done as much as we think we can do. Our testing network has been built up. We're testing more than anybody in the state. Each day, thousands of people are being tested throughout the county through our partnerships and sites we've set up. We have the largest local network of testing in the state of Maryland. Yesterday, we set a record of 2,900 people being tested through our network of testing sites. In collaborating with Maryland Department of Health, Montgomery County serves as an early adopter of the state's point of contact testing program. We begin using the Avid Binax Now rapid test in late November 2020. The point of contact testing program will begin in phases, considering those with highest risk based on residential location and employment related risks. Some examples include individuals who may be at heightened risk for exposure to COVID-19 themselves based on their work or home environment, communities that are experiencing significant levels of COVID-19 transmission, or vulnerable populations. And I'd say the addition of the work environment, we talked with the state, they asked us what kind of help we need, and we said it would be especially useful if we could get testing on a wide scale into work environments. We have zip codes that obviously have higher levels of infection than others, but many of those people in those zip codes work in the essential jobs in front-facing work. Many of them are in work where they do not and are not fully protected consistently. And that's very likely one of the sources of infection that's being brought to these high infected zip codes. So I'm glad for the state's cooperation on that, and we will continue to work with them. We continue to work with our hospitals. We meet with the local leaders. We've discussed their capacity needs. Currently, they have adequate supplies of PPE, ventilators, and other critical care equipment. Our staffing continues to be a significant issue for hospitals. They have capacity to add more rooms, but they need to add additional staff to support the expansion. Hospitals put in place a significant surge plan in the early stage of the pandemic. It's robust and it's comprehensive. And we're going to continue to utilize those strategies to address the increase in cases and any potential future surge. And we've prepared for tough times ahead, but we're going to continue to work diligently. I want to emphasize that we cannot stop now. We've been dealing with this virus for 9 months. I'm assuming everybody reads the newspaper. We know that vaccines will come, but we don't know how much. We don't know how widely available they'll be. We do have evidence apparently that they will be relatively effective, which is the good news, but you need quantity of vaccine and you need to be able to deliver it deeply into the population. I know this virus has tested everybody's tolerance and our patients, and it's really hard for people. I know it's really hard for people. It is difficult, and I think it was more difficult, a few months ago when there was no clue about what the end of this would look like or when the end would come. I think that you can look out and look at the presence of vaccines and the development of treatments, and at least take some comfort that there is an end in sight, even if we don't know the precise date. But this certainly, we will have the tools to manage the virus better. And hopefully that gives some people some comfort as we try to get through the last stages of not having the vaccines or the treatments. We're not going to stop doing what we need to do in the meantime to stop the spread of this. And so you will be seeing additional measures coming from the county. I was very happy this week that the other counties followed us, and many of them took steps to reduce the exposure to coronavirus in their communities. And I think that was really important. I'm going to say what somebody else said is, we may all be tired of COVID, but COVID is not tired of us. It's alive and well, and we just cannot let down our guard, and we can't back down from the things we're doing. As we head toward the Thanksgiving and holiday season, it's important we think about protecting our family members. I don't want to be celebrating on Thursday and visiting somebody in the hospital a week later. We have some really hard choices to make because these holidays, are coming up, have been, for all of us, major points of getting together with our families. I mean, holiday travel is legendary. And we're basically asking people not to do it. Not to have more than 10 people in your house, not to bring people in, your family, your cousins, your aunts, your uncles, your relatives, and your best friends, to have big feasts together, because those are cited among the leading causes of the spread of corona. When they do contact tracing, it is these gatherings, these large gatherings, that seem to be primary contributors to the spread. So as hard as it is, the best thing we can do for the people we love and care about is to see them on a Zoom call on Thanksgiving, not try to get together with them. Even staying 6 feet apart inside a room with a lot of people is not going to cut it. And so, as hard as this medicine may be to swallow, I'm hoping that people take the advice that we forego for this year the celebrations so that we can have better celebrations next year when the opportunities present themselves again. And hopefully with everybody who would have been here this year, we'll be able to have them all come back next year. So I'm changing how my family is going to celebrate this. We will not be doing indoor gatherings. We will not be trying to bring everybody together and all our friends, so it's going to be small. We need everyone to wear a mask and social distance. We need the masks on all the time, 6 feet distance or not. We're telling people that the masks have to stay on. We've had 875 people in our county die from this virus. So I'll just close by saying we need everyone here to do their part to slow the spread. And with that, I'll turn it over to Dr. Gales.
Good afternoon, everybody, and happy Wednesday. Always a pleasure to be with you. Before I give comments about COVID and other things, I do want to acknowledge in recognition of Transgender Day of Remembrance on Friday and acknowledge that date, particularly given that there's lots of stories and health issues that have been lost in the conversations related to COVID. And one of them is the unfortunate continued violence against transgender women throughout our country. And want to take this opportunity to acknowledge that, to put on everyone's radar and acknowledge Transgender Day of Remembrance on Friday. Now, to shift and pivot back to COVID-related issues, as the county executive has mentioned, the numbers have continued to trend in the wrong direction. The average positivity for the state is now just shy of 7%. Ours is around 5.5%. And when we look at the case rates, all jurisdictions have rates above 10 per 100,000. 19 of the 24 jurisdictions have rates above 20. And 9 jurisdictions have case rates that are now over 30 cases per 100,000, including all of the Western Maryland counties, Baltimore City, Baltimore County, Harford County, Prince George's, Somerset, and Wacomico. And where our numbers stand, we're at 25 cases per 100,000. So just to underscore that we have put in a first line of restrictions, and we are continuing to look at the data, as the county executive mentioned, looking at contact tracing data to determine if and what particular next level of restrictions we may need to put into place or recommend in order to get the numbers headed back in the opposite direction. I do also want to highlight a couple of bright spots. The governor did put out a host of different restrictions yesterday. One of them I do want to highlight are the restrictions that have been put into place for nursing homes. There have been tightening restrictions around the requirements of how frequently residents and staff need to be tested. And as the order states, is the requirement will be that facilities will need to test residents and staff approximately twice a week. That is an update to the policy that had been changed when numbers had dropped to be related to the test positivity of the specific jurisdiction. And as the county executive also mentioned, our testing numbers have increased significantly. Yesterday alone, the whole combination and collective efforts of the different parts of the county testing apparatus tested just shy of 3,000 people. And we continue to increase opportunities later in the evening, as well as making sure that there are opportunities available on the weekends. And I would encourage folks, particularly as they're thinking about their holiday behavior, thinking about getting tested, and to go to the county website that lists all of the different testing options, in addition to any of those that you may receive through your primary care provider, should you have one. The county executive also mentioned that we've received positive news and promising news related to 2 vaccine candidates, one through Pfizer and one through Moderna. We continue to work with our partners in the state to discuss strategies to be able to effectively begin dissemination of those vaccines once they become available. The best case scenario so far that we've been presented is that potentially as early as late December, the members of the first priority group, including first line responders and those who are over the age of 65 and those with complicated medical conditions, will hopefully be able to start receiving those vaccines by the end of the year. I will stop there and turn the floor over to Dr. Stoddard, but as always, happy to answer any questions you may have. Thank you.
All right. Good afternoon. A couple things I want to update on. We had a meeting. We are focused on increasing our inspection capabilities. Obviously, the governor has alluded to the fact that he wants to see more local enforcement. And while we don't believe that our local enforcement has been lacking, we are taking that, feeling to heart and looking where we can increase our inspection capabilities across the board. A few areas where you will see the county doing some additional inspections are in our big box stores. We have heard a number of concerns raised about our grocery stores and other large establishments who have been open since the beginning of the pandemic, but where sometimes the numbers have, or recently the numbers have either increased in terms of people being allowed in the stores, or there has been a waning of the compliance as it relates to face coverings, cleaning, and other measures. And so we're going to be out doing a lot more proactive enforcement and education in our big box stores. We were also working with our Department of Permitting Services to bring together our construction sites to talk about compliance on in our construction sites. We know that the workers on those sites are disproportionately Black and brown people, and as frontline workers, they are, that is the venue in which we see the most concern in terms of potential exposure. And so we are focused particularly on that population to ensure that the safety measures are being met. This past weekend, we did have enforcement out with our restaurants and our late night establishments, and we only issued a single warning. We actually visited all 3 of the streeteries across the county and found them to be generally in good compliance when we visited. And so generally it was a good weekend, but obviously that program will change substantially on Friday with this governor's implementation of a 10 p.m. Closure order for restaurants and bars. We have issued on Monday, finally, this ventilation and filtration guidelines that I've talked to you all about over the last several weeks. On Friday, this coming Friday, we're actually meeting with our business community to talk through those recommendations and guidelines. We're also going to have some of the subject matter experts who helped provide feedback on the guidelines that we developed, and they'll be able to speak to the work that some of the their organizations they represent have done in this space and what they've seen about HVAC related guidelines and COVID. And so that'll be Friday afternoon. We were also working on a webinar with our houses of worship. We know that obviously the most recent executive order did further restrict houses of worship to be in line with the 25% limitations that retail restaurants and others have seen. But we have seen in our contact tracing data, certainly over the last several months, an uptick, a slow but steady uptick in the contribution that houses of worship and religious services have had in the people who are COVID positive. And so it climbed from about 13% back in August to about 20% in the high risk gathering category in Montgomery County. And so obviously it went from the number 4 high risk gathering to the number 2 high risk gathering. We want to make sure that we're working with our houses of worship to combat any sort of rise in COVID that may be seen amongst our worshipers across all denominations in Montgomery County. And the last thing I will note is we do have our next Community Recovery Advisory Group meeting this evening. We're going to be talking about some of our vaccine delivery developments with our community so that we can get some community feedback on how those plans should be developed and what considerations that should be made from the diverse array of participants. In addition, we'll be talking about some of the innovations that we've undertaken during our COVID-19 response and where we recognize opportunities for the county to operate better with our partners. And so I will stop there, and I think we'll be happy to take questions.
All righty, thank you very much, gentlemen. We have a hard stop today at 1:30 on the dot. So we have exactly 33 minutes to answer all the questions. The chat box is full. We have about 8 reporters interested in asking multiple questions, and we will get started with Jordan Lindsay, my MC Media, with a question for Dr. Gales.
Thank you so much for this briefing. This first question, I have 2 questions. The first one is actually for County Executive Elrich and Dr. Gales. I just wanted to make clear and understand, are there any additional restrictions in the county following Governor Hogan's announcement yesterday in terms of any updates in the executive order and restrictions? I just want to make sure of that.
We are looking at, to answer your question broadly, not just secondary to the governor's press conference yesterday, but more in response to the numbers and where surveillance data stands, we're continuing to assess and continuing to think through strategies that may include additional, restrictions and recommendations that will go into effect in the near future. We're not ready to announce any of those yet as we continue to look at the numbers. Now, that said, we have discussed a couple of preliminary steps that in response to some of the actions that some of the other jurisdictions have taken, including for social gatherings, for indoor settings, taking that and moving that from 25 to 10. These would be for social gatherings, types of activities, and for outdoors at 25. And then looking at making, as the county executive referenced in his opening remarks, making the face coverings required even when in outdoor settings, which would be comparable to, for example, the order that's in place in DC and what was recently put into place in Prince George's County.
Great, thank you so much. And also, too, has there been any changes to hospital care in the county based on Hogan's announcement yesterday? For instance, will rescue services transport patients to different hospitals than before, or will patients in Montgomery County hospitals be transferred to hospitals outside the county given any different circumstances?
I think as it currently stands, operations and business will be as usual for the health systems and hospitals within the county. Well, certainly, I do know that there are one of the differences between where we stand now and where we were before, as the county executive referenced, is that when we were in the first stages of the pandemic back in April and May, we saw lots of the cases were concentrated in the larger counties, for example. You heard frequently cases in, the National Capital Region or in the Baltimore metropolitan area. You didn't see and didn't hear as much about cases in other parts of the state. That's very different now. It's not just us reporting increases. We're seeing increases in Western Maryland. We're also seeing increases across the board in the counties on the Eastern Shore. And so that is going to create a challenge for health systems because before it was, a limited number of places that were seeing significant surges and increases that put a burden on the health system. This time around, everybody's experiencing it. And so, for example, from a staffing perspective, it's going to create challenges, and it may limit the ability to be able to move patients around to other areas that may be less impacted to be able to absorb the surge from other areas. But as it currently stands, we will continue to operate business as usual, and patients will be sent to the necessary facilities by transit. And the other thing I just want to take the opportunity to emphasize is if you are a resident at home needing health services, do not postpone going to the hospital. Don't sit at home and wait for your condition to worsen. If you need medical treatment and medical attention, please seek those services in a timely manner. The hospitals are open for business.
Thank you so much.
Thank you, Jordan. The next question, Rebecca Tan for Dr. Gales. Rebecca from the Post.
Thank you for having me. I have two questions, one on testing and one on nursing homes for both Dr. Gales and Dr. Stoddard. My first question is whether you've seen in the county an increased demand for testing, and is this translating into longer lines or sort of the wait times for testing results to increase in the same way that we saw back in the spring?
So yeah, we actually are seeing a lot of folks coming in, an increasing number of folks seeking testing. And fortunately, we've been able to absorb that demand so far, and we've actually increased our ask from the different laboratories that serve just the county apparatus. And when you look at, as the county executive referenced, today in the state of Maryland's case reports, it was pulled out of over 31,000 tests that were resulted across the state. Over 7,000 of those tests were from Montgomery County. And so it's not only an increase in testing as provided by the county apparatus, we're seeing increased numbers from the healthcare enterprise outside of that. Now, as you mentioned, that does create some challenges because, again, not only are we seeing increases in our area and across the state, there are lots of other areas across the country as well who are seeing increases and increase in testing demand. And we're continuing to monitor the trends to see if there's any significant change in the time from within which a specimen is collected and the result is sent back. We certainly hope that with increased capacity over the pandemic, that we, even if there might be slight increases in the wait time for results, we're hopeful that there won't be a significant wait time experience like we saw earlier on in the pandemic.
Sorry, just to clarify, you said Montgomery County tested 7,000 people yesterday, or is it today?
No. So what it's the way the state reports their surveillance information is it's not necessarily off of the daily test total. It's how many tests were resulted on a given day. And so based upon that information, what we were reported today is that in that number where we're talking about 2,000 cases for the state and 262 for Montgomery County, that is pulled from 31,000 tests that were resulted today. And of that 31,000, 7,000 of those tests were collected within Montgomery County.
Got it. Got it.
Yeah, and so the simple math there is that we did 22%. We had 22% of the tests resulted yesterday, but only 13% of the actual cases that resulted from those tests. And so we're doing absolutely more than our fair share in Montgomery County, and that's across the enterprise, not just county government. Obviously, I think the county executive said, you know, we conducted to distinguish between the 7,000 yesterday, which were resulted. Those are the ones that got through the lab. The 2,900 that we collected yesterday will be going to the lab, or went to the lab yesterday, and will be resulted over the coming days. And so those numbers are both very high, and certainly, you know, the 7,000 number is nearly twice what any other jurisdiction has resulted yesterday. So we're doing a lot of testing in Montgomery County. We have seen an uptick in the people looking to be tested, which actually is you see this across the nation. As cases go up, more people have reason to go get tested because they've either believed they've been exposed or concerned about having been exposed, and therefore that drives testing volume to increase, and that is exactly what we've seen.
Got it. And my second question, you know, the virus has clearly returned to nursing homes in Maryland and in Montgomery County specifically. Can you talk a little bit more about what the county is doing to prevent further spread? And, you know, you mentioned the twice weekly testing, right? Facilities have already said that they had trouble complying with the once weekly testing. Is the county going to step in here and help them comply with this new requirement?
Well, the county has been working very closely and carefully with the nursing homes and assisted living facilities throughout the pandemic, and even during kind of a quiet period, if you will, during the summer months where we did not see a lot of cases in those facilities. The team continued to provide technical assistance and support to those facilities. And most recently, where we have had an instance in at least one facility where we've had a number of cases, not to the comparable level of what we saw in the spring, but we've been constantly monitoring those. We work very closely and carefully with them to provide that technical assistance to make sure they have the resources to conduct the necessary testing that they need, and certainly that all of the facilities have access to personal protective equipment to mitigate any risk of transmission from staff to their residents and so forth. So we will continue to do that. We will continue to leverage the resources that the state provides as well. The state has been doing site visits as well to different facilities over the last several months. They will continue to do that, and we will continue to support those efforts again to increase the assistance to those facilities in general, but certainly those facilities who need it the most, as evidenced by their case count.
Tom Fitzgerald with Fox 5 with questions for the county executive and for Dr. Stoddard. Tom.
Good afternoon. Thanks for doing the call again. I'll give you two questions at once, so we're not going back and forth. For the county executive, you know, we just discussed future measures that might be under consideration. Dr. Gales went through a couple of those. I'm curious about some developments around the country, though. Specifically, California and Ohio, the governors there have instituted curfews right now. There are several municipalities in New Jersey that is looking at that right now. Is a curfew something that you would like to see in Maryland? And is it something locally in your jurisdiction that is under consideration right now? My second question, I think this would go to Dr. Stoddard, but I'm not sure. Maybe Dr. Gales could weigh in. There is a soccer tournament planned for this weekend between the 20th and the 22nd at the soccer complex. It's the Premier Cup. Apparently this was approved back on the 10th the 12th rather. Wondering if that's still a go. A lot of these teams apparently are coming from out of state, Ohio, Pennsylvania, some of them Florida. Organizers have told us some of the teams have already canceled, but I'm wondering if you could update the status on whether that approval is still in place.
I'll go first on the curfew. um, I would like to see the governor go back as close to phase one as we could go, and try to ride this thing at that level, because that's when we were able to push these numbers down. I would like to go back to a strategy that drove the numbers down, because if businesses are closed, I mean, he closed all restaurants at 10 o'clock. We were letting people stay open, but you couldn't serve alcohol. Now it's like a flat out closure. There may not be places to go. And the burden on law enforcement to enforce, a curfew would be enormous. I would rather just eliminate the places where people can gather and set rules about size, and tell people just, if it was like in the beginning, if there was no place to go, we really didn't go anywhere. You weren't meeting people because things didn't facilitate that. So if we could get back to that, I think, we could see whether that breaks it. As I used to tell my parents, anything I can do after my curfew, I can do before my curfew. So just saying that you got to be in at 10 or you got to be in at 11 doesn't mean you couldn't, gather with too large a group at 9:30. So I would rather focus on not being able to gather and closing down the places where you do gather before I went into anything like a curfew. That's just my take. We haven't actually used the word curfew, I think, in our discussions to this point. We've really focused on closures and limitations on gathering opportunities.
We also don't have the number of nightclubs and other kinds of establishments that might drive a curfew to be more valuable in a place like California or perhaps Ohio. So I think that's one of the reasons we haven't discussed it in those terms. We've targeted, the kind, where we know gatherings happen in Montgomery County. To your second question, so just give for everyone's context in case those who don't know so over the later part of the summer, Soccerplex approached us with this soccer tournament opportunity. It was actually a pair of tournaments, as you noted, Tom, that began last weekend with a girls tournament, would continue next weekend with a boys tournament. We did a site visit. They submitted a very robust plan that we reviewed and approved. With the change we approved it several months ago, actually, and then they resubmitted based on the new gathering limitations. We re-reviewed their plan and did give them a letter of approval to proceed this past weekend. That said, we did review this morning, and just to be clear, there is an ongoing investigation that public health is conducting based on last week's tournament. And obviously our case counts have continued to increase and not stabilize in any way. And so we did issue a letter rescinding the letter of approval to allow the next weekend's tournament to proceed today. I spoke to Mr. Lieber from the Soccerplex, and they're understandably upset, but we decided that based on the increasing case totals, and I want to make it very clear, their plan was very robust, and they made every reasonable effort they could to make that tournament as safe as possible. But simply put, there was at least one person who participated in the last week's tournament who was infected and did likely expose some number of other participants. We're doing the investigation now, and I don't know if Dr. Gales has any more to add to that. But obviously, based on that experience, we said, we made a good faith effort to get them into a good place to proceed, allowed them to proceed last weekend, but based on the experience so far, they did a good job trying to implement what they could do, but weren't able to limit the potential exposures. And with that in mind, we decided to rescind their letter of approval for this weekend. And so I think that's
all right. Thank you.
Thank you. Chris Gordon, NBC, 4 questions for the three officials.
Yes, thank you very much. I'm just trying to clarify, for the last 2 weeks, you've been talking about wanting a regional plan, regional cooperation. And you were probably ahead at one point 2 weeks ago, kind of felt alone and that others would follow, and others indeed have followed and are still following in DC today and in Virginia today. I don't know if you're going to have one of these updates next Wednesday, the day before Thanksgiving, but when is the next time you see a possible increase in restrictions? And what would you like those to include if you, Mr. County Executive, feel frustrated that the governor didn't go far enough?
I'll be talking to my colleagues today, and we have another call next week. We're talking ourselves internally about what we want to send over. If I had my druthers, I'd get everybody down to 25% capacity, I think. I'd like the governor to entertain that. I can only imagine if all the predictions are right, and we've all seen some of these predictions, then the situation is going to be worse 2 weeks from now than it is today. And at some point, the governor's going to have to do something more. I kind of feel like I have all along, but you can kind of see what's coming. The sooner you begin mitigation, the smaller the base of infection there is in the community. The longer you wait, the more you've got the virus out there, the less effective is what you're going to do, because you've already got the virus deeper in the community. If my health officer thinks I'm straying too far in this, he should feel free to chime in. But I'm a believer that if you know where you're going, you might as well act before you reach a later trigger point, because you will have more infection in the community to start with, to launch off of, so to speak, than you do if you act today. So I would like to see us all get down to the lower occupancies, I want to go to the all mask all the time, as Prince George's County did in the district. And I would like the governor to do the same. I mean, it's no longer these counties in the center part of Maryland along 95 that are the problem. I remember when it was like, well, why would you close down Western Maryland? They don't have any cases. Now everybody's got it. So I think this is the moment for a uniform statewide policy, because you don't have good places and bad places anymore. You've got all bad places. So, I'd hope the governor can get there sooner than later. And we'll make a decision about a press conference next Wednesday. I have no aversion to doing another conference next Wednesday. I think it's useful for us to brief people and let them know what we're thinking. And if the virus isn't taking a holiday for Thanksgiving, I don't particularly see why I should be taking a holiday for Thanksgiving. So I'll leave it at that.
All right, we have just a very few minutes left. Kate Ryan with WTOP has questions for the three officials. If we can speed this up, it'll be fantastic. Kate? Kate Ryan?
Okay, yep.
Oh, there you are. Okay.
Yep. Quick question for Dr. Gales on vaccine and vaccine storage. Again, we understand that Pfizer's require that deep freeze and that's a 2-dose situation, and that the other vaccine, that may not be necessary. How will that play out in distribution in Maryland?
Well, so what you're referencing is, so the Pfizer vaccine, the storage temperature is significantly lower than the Moderna vaccine. And there's some differences in terms of the shelf life, in terms of how long you can use it, depending upon how it's stored. And so as part of the original vaccine planning, we have been doing a needs assessment and a capacity assessment to look at our volume. What types of storage spots do we have available? What types of temperature settings do they require? And so that will be something that we continue to assess, to look at what types of resources we have. And it could, so I say all that to say that both potential vaccines, in spite of those storage requirements, would be very beneficial to be able to be deployed and disseminated throughout the community. As we get more specific information, both in terms of the storage requirements, as well as the need for multiple shots to complete the series, as well as the time frame within which the first shot will happen and the second shot will happen, we'll be able to make our plans more specific and figure out how each of those candidate vaccines can be used in different settings.
Got it. And for the county executive, money to small businesses. This morning in the Board of Public Works meeting, the treasurer made a comment about being ready to write checks and get them out the door. What exactly is the problem? Where along the chain are we running into problems? And what do you tell a business who's right now saying, how long do I have to wait?
Our problem is I just can't write a check when somebody walks in the door and says, I need help. I mean, that's not the way this works. So you have to have a program and you have to have criteria. And every time we set up programs, since we knew from the beginning, even when we did our first assistance program, we had enough money that would go out the door in 1 month. We didn't have money to spend those many millions of dollars a month every month. It wasn't there. So we had to pick, what are the criteria? How much losses do you have to show? We have to do the same thing now. We have to look at what resources we'll have and make sure that we can get them out there and then probably target the people most at risk. I mean, you could argue probably that almost everybody is having losses unless you're an online retailer. And then this is probably a wonderful time for you. But if you're a brick and mortar place or a restaurant, most of them are probably struggling. So we've got to develop criteria and a program to put it out through. We've got a restaurant program that's up now. Our staff is making estimates because we've got a lot of programs we created. Not every program will spend every last dollar. Some things are undersubscribed. We put out money for teleworking. The council worked with the Economic Development Corporation, had a teleworking fund, and not as many people subscribed as we thought. So what we've done is we've set in motion a process that by December, we will sweep all the accounts of money we don't think they're going to spend by the deadline, which is the end of December, and put it into programs that we know we can get out before the end of December. So if some of them don't spend down, we're not going to leave the money sitting there and hoping that something happens. We'll take money and we'll move it to where we prioritize it. And just to be clear, my priorities that I've told staff is assistance to individuals who have rent issues and assistance to small businesses, nonprofits and the like, trying to help make sure we can keep those places open.
Gotcha. And I know time is short, but is there like with vaccines, we can go, yep, there's a 2-day turn on that. There's is there an average turnaround time on processing these?
There's not an average because it depends how many people apply. I mean, it takes a long time to review documents and verify documents. I'll give you an example. We've got this housing money out there. We've literally gotten hundreds of applications from people who do not live in Montgomery County. We have applications from people who haven't lost any revenue. And we have applications from people who are not behind in their payments. So unless we do our due diligence, we would put money out to folks who either aren't eligible for it or don't need it, and deprive people who need it of being able to get it. And the good thing on that thing is, since the governor has postponed evictions, and because these checks are going to go mostly to landlords, not to the individuals, we'll be able to send out a certificate authorizing that telling the landlord that you will be getting a payment. And the government has been accepting of commitments so that I don't have to write the check that day, but I've got to get the commitments out that day. That's what we'll do to get the commitments out. But this is far from a simple process. You can think of all the businesses in Montgomery County, every restaurant, every childcare center, every small retail shop. There are far more people who could apply and will apply then we have money to give out.
Gotcha. Gotcha.
We got to do this right. Otherwise, if we fail to do it right, we run the risk of the feds coming back and saying you gave it to people who weren't eligible and now you owe us the money back. Don't
Understood.
want to do that.
And I have one very brief follow-up for Dr. Stoddard on compliance in connection to the Soccerplex tournament. There had been some, and this is pure rumor, I'm just trying to knock down speculation among parents. There had been sort of a, hey, get your kid tested. And if they test positive, or if you have someone in the family, just don't say it and go into the tournaments. Do you have any evidence to suggest that's the kind of thing that may have happened here?
No, we don't have any evidence to suggest that. And certainly if we did have evidence of that, we would very much be interested in having it, because obviously that would be incredibly troubling to hear. The circumstance that we are aware of, and I, not to reveal anything about the personal nature, but what's that? Yeah, we won't go down there. But essentially, it was someone who should not have done what they did, but it seemed very much like an individual decision as opposed to one that was in any way supported or concerted by the event organizers.
All right, we're going to move forward. For those of you watching at home, either through Facebook or County Cable Montgomery, there will be a cutoff of this programming at about 1:25 p.m., but the recording will be placed later on Facebook. For the reporters here, we will continue on the Zoom platform. Randy Bass with WDVM with questions for the county executive and Dr. Gales. Randy?
Good afternoon. Thanks so much for taking my question. Before we always asked, for metrics regarding reopening, and now we're in a very different position. So now I'll ask the opposite of that question. Are there a set of numbers or metrics that you believe would call for the complete closure of businesses or a stay-at-home order again? And are we already there? Are we already at a threshold that would warrant those kinds of restrictions?
Randy, thank you for your question. I think that's the first time we've been asked about closure guidelines as opposed to reopening criteria. I think we'll be just very candid is when you look at our dashboard and you look at those measures we put forward, the same way we would talk about in terms of reopening, looking at cases, looking at test positivity, looking at rate of transmission, as well as those secondary quality criteria focused around hospitalization, utilization types things. We're not in a good spot. When you look at I will say this, we have yet to see the hospital surge and the fatality surge, but if you recall back to the spring, that surge lagged behind the case surge. So I don't want folks to say, well, you have more cases, but you don't see the hospital numbers increase. That's not an accurate depiction of where things could go. So right now I will say this, it's extremely troubling that our case rate is higher than it's been throughout the pandemic, and it is not trending downward. We're seeing more days in the 300s than we are in the hundreds now. And I think what's also very troubling is we're seeing the increase in hospital utilization tick up as well, to start to match those increases in cases. I'm hopeful that we don't see an uptick in COVID-related fatalities, but we'll have to continue to monitor those trends. So in summary, I think what we're looking at right now, if you do an apples to apples comparison to where we were in the spring, we are past the numbers of where we were when we shut things down the first time. And the county executive mentioned that we were effective when we had more restrictions in place, limiting points of contact and transmission. Those were the types of things that drove the numbers down post the original surge. And I think we have to take a very hard look at some of those practices that were successful during the first wave to have the same effects during the second time around.
Thank you,
Yeah,
Dr.
I think
Gales.
if I may just add briefly, the hospital numbers are obviously sort of the next really big area of concern for both ICU beds and for total inpatient beds. We are slightly below the 80% 3% mark, which I think represents where we move from the low to moderate in terms of hospitalization. And so both of them were within like 3% of that next mark. And so I would, I think that's the thing that, we're paying a lot of attention to that, because hospitalizations, just like cases, hospitalizations like cases, deaths like hospitalizations. And so when we start to see hospitalizations get to the level where we're starting to really put real pressure on the hospitals, that's when, the ambulance, the sirens are going right now, but that's when, things really start to become life critical when the hospitals start to see that level of surge.
All right. Thank you, Dr. Stoddard and Dr. Gales. One more question from Scott Broom, WUSA 9. A question for Dr. Gales. Scott.
Sure, thanks. Listen, I want to make sure I want to make sure I get my reporting squared away here, because, the governor's on TV yesterday saying, look, if you're a college kid, get tested. If you're going to see relatives, get tested. You all mentioned the huge testing surge that's gone along with this surge. We've got lines outside testing stations. It's attracted our attention. Is this sort of travel related or holiday related testing separate from people who are, maybe have a contact tracer call? Is that creating lines here? And does it stress or threaten the system, or would you encourage these people to get tested because all testing is good? I'm just trying to sort of summarize that for my audience, because of the lines we're seeing right now in these big numbers you're reporting.
Well, we would encourage folks to know their status, regardless of if they're traveling or sitting at home, because you can transmit even. And I think we've maybe gotten too attached to certain things as reasons for cases increasing. You can come into contact with COVID walking in a facility, going to school, going to your business, going to your gym, flying to seeing other relatives. And so it's important not to just say only get tested if you're going to travel. We want you to get tested if there's any reason to believe you've come into contact with someone, if you're exhibiting any type of symptoms. And certainly there are situations where we would encourage folks to get tested. For example, the kids coming home from college. You're coming from another area and coming into your space. And so we want to make sure that you're not bringing anything with you and you take the necessary precautions. If you're going to be leaving here and going to visit other relatives, for example, we would encourage you to get tested again so that you know your status, to minimize any potential exposure to others within your network that you may come into contact with. And so if it does overwhelm the system, quite frankly, that's a good problem to have, because that means more people are getting tested. We know more folks' status, and then we can hopefully identify any of those cases that otherwise we wouldn't have known about had they not been tested, through the necessary channels of contact tracing and isolation protocols.
Make sure I characterize this appropriately. What I'm getting from this is, number one, please consider revising these plans regardless. But if you must carry through with the plan, get tested. Accurate?
Definitely.
Okay, very good. Thank you.
All right, we have one last question from Donna St. George with the Washington Post, and for the county executive and Dr. Gales. Donna. Donna? Are you still on?
Oh, I'm
there.
Here.
You are. Okay.
I didn't unmute it. Sorry about that. For Dr. Gales, I had a question. Can you tell us how often you've documented in-school spread during these last few months when many private and parochial schools have been open in the county?
What I can tell you, Donna, I know you ask this question each week. We don't always have the exact numbers, but what I can tell you, looking at our spreadsheet right now, including childcare facilities and schools that are open, we have 29 active investigations ongoing at this point. And in terms of completed investigations, up to date, including both schools and childcare facilities, we've combined that information, and I'm just waiting for my spreadsheet to populate right now to give you an exact number. I do know as of last week, that number collectively, including closed investigations of actual COVID cases as well as COVID-like illnesses, was over 400.
Okay, and I was saying in-school spread, so not just individual cases, which I've asked about a lot, but spread within a school.
Right, and so what I'm trying to what I'm trying to say is I don't have that specific number at hand. I'm trying to give you additional context. Now we have, because it's hard to pull apart the numbers. Now what I am saying is that when we have done those school outbreak situations, there have been multiple schools where there's been there's been multiple cases involved, but in terms of in-school transmission, that number has been smaller. In terms of not quite 400, it's probably been in the low double digits in terms of where we have had, cases where, there's been spread in the school before we've had a chance to actually step in and interrupt those networks of transmission. The same cannot be said about the childcare facilities. We have seen a number of instances, and again, I don't have the exact number, where we have seen potential spread in cases from staff to children and child to child transmission within those settings.
Thank you.
I hope that answers your question.
Yes, thank you so much. And I did have one question for the county executive as well, which is the school system, the public school system has been sending out letters when there are positive cases associated with its schools, even if it's just one staff member and there aren't students in the building. And I wonder how important you think it is, or whether you think it's important, that cases for private and parochial schools are also made public.
I think it's important that the public have a sense of what the whole picture is. I mean, I get frustrated because if stuff doesn't get reported or people don't know it, then they point to things and they say, there's no evidence that this is happening here or this is happening there. So why are you doing what you're doing? And I think it's important to know what exactly the evidence is. It may not, it may be different than what one expects, but I think it's important that everybody know it. And I think there are issues that are obviously out there. And if people think there's no problem, then they reach one conclusion about what's safe to do. If they realize there is a problem or can be problems, they may take a different tack on what they think is advisable to do. Not knowing about things and then trying to form opinions when you don't know something is not a good practice.
Does the county plan to make those names public, or how would that happen? Under what form?
I'm not sure the names are as important as knowing what's happening.
So
just like we wouldn't identify when people had COVID in the beginning, we wouldn't say this is the person and this is where we are. That would violate their privacy.
So Donna, the state actually has a website now where they do release that information for any of the schools that meet the definition, the state criteria for outbreaks. They do actually list the name of the school, and they have the name on the website for the period within which there is an active investigation going on or an isolation period. Once that has been completed, the state pulls that name off. This is the same approach that they did for nursing homes earlier on in the pandemic in terms of reporting that information. And again, from our perspective, our goal is to work with the schools to identify cases, identify the necessary folks who need to be quarantined. And as you mentioned, I think in the overwhelming majority of those situations and cases, the schools have notified their families and their students about potential exposures. And we've, they have helped us and assisted us in completing the contact investigation so that we can make sure all of the appropriate contacts have been identified.
Yeah, I'm aware the dashboard, it only has a couple Montgomery County schools on it. So unless if the number is greater than a couple, they're mostly not there because it's only outbreaks. It's only outbreaks.
Yes, that is correct. It is only listing outbreaks, and by definition, you can review the state definition. It has to be multiple cases there, and then they can't be from the same household. So there are a number of parameters that influences that. But that again does not mention the situations where we do find, an index case in a school where there is a quarantine activity secondary to that case because it doesn't meet the state's criteria for outbreak. That's correct.
That answered that question. And with that, I think we're going to wrap up this session. Thank you, everybody, for joining us. Thank you for participating, Mr. County Executive, Dr. Earl Stoddard, and Dr. Travis Gales. Good afternoon, everyone, and stay safe.
Thank you.